Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over what an ABPI is, okay? An Ankle-Brachial Pulse Index, and how we use this to diagnose peripheral arterial disease. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So what is an ankle-brachial pulse index? Okay, so an ABPI for short. It was first described in the 1950s, okay? So it is a non-invasive diagnostic tool, okay? So it is used for the early diagnosis of peripheral arterial disease. So it is the ratio between the systolic blood pressure measured at the ankle and the systolic blood pressure measured at the arm, okay? This detects stenosis, okay? So the narrowing of the vessels, it's mainly, so ABPIs are mainly used for diagnosing peripheral arterial disease, but they are also a great tool that we use in wound care, okay, for healing and management. So to be able to use this as a diagnostic tool, we need to be aware of the normal values, okay? So I have included the normal values here. Now, values less than 9, okay, are diagnostic of peripheral arterial disease. Something is going on, something is starting, okay? These patients are at higher risk for cardiovascular disease, okay? And the lower ABPIs are also associated with ischemic ulcers, okay? We're not getting the proper blood flow to our feet, so we can get ulcers as a result, okay? So super, super important for wound care specialists in diagnosing and monitoring wounds. It also helps us it gives us an idea if we can actually compress a leg. So if somebody is having an ulcer on their leg and it's a venous leg ulcer, this tool allows us to see, okay, can we safely compress the leg to move that fluid so the edema that's sitting there with venous ulcers, move it back up the leg, and we can actually get healing out of the wound. So how is an ankle-brachial index measured? Okay, so first we have the patient lie in a supine position for 10 minutes, okay? Just so they can rest. It kind of equalizes their blood pressure so we get proper readings. So this is super important. We cannot miss this step or we will have improper readings. Improper readings are no good because then we can put compression on somebody, we can treat them, and maybe we can't, okay? Maybe we weren't supposed to be putting compressions on that person. We do not want incorrect measurements, okay? So rest for 10 minutes in a lying down position, okay? They should not be on any sedatives or anesthetics, okay? So nothing like that, because their blood pressure, we're not going to get a proper reading. We want to make sure that the blood pressure cuff is appropriate for the limb, okay? So at least 40% of the limb circumference is inflated. We're going to use a Doppler ultrasound, okay? So this allows us to hear really, really well when we use a Doppler. So we pump it up until we lose sound, okay? When that artery is cut off, and then we go up 20 points on the blood pressure monitor, and then we start releasing, okay? As soon as we hear a sound, we need to be looking at the number, okay, on the blood pressure cuff, okay? What number is that? That's the number we write down, okay? So the systolic number, we write that down, okay? We do that for both arms. We can have different readings in each arm. 100% cannot miss this step. Have to have readings in both arms, and you keep the highest reading. Okay, the highest reading is the one that you are going to use. Write them both down. Okay, I always do a little chart. So I have my left arm, my right arm, my left leg, my right leg. Okay, and I write them all down, making sure I have them. Okay, so then we do this for both ankles. Okay, so we just above the ankle, we put the blood pressure cuff, and we are going to do 2 arteries, okay, on each foot. So this does take some time to perform, okay? So we do the dorsal, which is on the top of the foot, and the posterior tibial artery, okay, on the inner ankle bone here, okay? So the inner. So we do the same thing, make sure. So what I personally like to do, I'll do one leg with one, okay? And then I'll do the other leg, do one, and come back to this leg, because we do not want to compress right away. There has to be a 5-minute gap between compressing a leg and recompressing it to get a proper number. Okay, and then once again, so once we are done this, we are going to take the larger number, okay, of each leg and use that number, okay? And then you're going to make a calculation for each leg using the highest arm systolic number and the highest leg systolic number for each leg. So 2 calculations, okay? And I'll show you that in the next slide here. Okay, so as you can see here, this is what it's going to look like when you do the ABPI. So this is on the arm. You're putting the Doppler on the arm, on the artery here. Now, see how it's not at a 90-degree angle to that vein? You want this angle. That's how we're going to get a proper reading. We have to have it angled. Okay, if we have it directly on, we could be putting too much pressure, kind of stopping blood flow more than what we need to, because we do not want to be interfering with the blood pressure cuff. We want a proper reading. Okay, so that's how we do that. And you can see here the 2 different arteries. Now, when we have our numbers, so we have a chart, we have them all written down, all of our numbers. Now, what we do, we take our brachial, we put it on the bottom. We take the highest number from our foot and put it on top, and we divide it, okay? It should be around 1. That's normal. That's where we want to see it should be almost equal to 1. So the diagnosis of peripheral arterial disease and using an ankle-brachial pulse index. So according to recommendations given by the American Heart Association, they are stating that patients should be evaluated of peripheral arterial disease if they're over 50 with a history of smoking or over the age of 70, okay? Because a lot of times patients with peripheral arterial disease have no symptoms, okay? If we can catch it early, do early screening, it's always better than waiting until we have complications. So the Ankle-Brachial Pulse Index is an amazing diagnostic tool in the screening and evaluation of peripheral arterial disease. And it can also help predict the risk of amputation, okay? But there are times where we should not be using this tool, okay? So if somebody has a deep vein thrombosis or suspected deep vein thrombosis, we should not be using this. We should not be compressing the leg whatsoever. And I also want to add in on this, if somebody has a stent put in to their legs before, or if they've had surgery on their legs, on their veins, on their arteries before, do not compress the legs. Okay, we do not want to be doing this. We do not want to dislodge anything. We do not want to dislodge a clot. Okay, because this will cause an embolism. We do not want this. Okay, if somebody has severe pain in their legs, don't attempt to do this. Okay, it is going to cause them so much pain. So if somebody's already having throbbing pain in their legs constantly, if we go to compress their legs, it's just going to be such an aggravating pain for them. We should not be doing that. So I hope this video has given you a better idea of what an ankle brachial pulse index is and how we use it in diagnosing peripheral arterial disease and how we use it in wound care. But that's all I have for this video, guys. I hope to catch you in my next one. Bye for now.